Agreeing a standard definition of what constitutes surgical resectability in pancreatic cancer is critical to its treatment. This project was born out of discussion by clinicians on areas of deficiency in the statewide data at the Victorian Pancreatic Cancer Summit in 2017. After the summit, the importance of patients receiving effective systemic therapy was discussed. It was acknowledged that delivering chemotherapy prior to surgery for patients with borderline resectable PDAC was a promising new approach. A statewide audit confirmed inconsistencies in the classification of borderline resectable disease. The adoption of a common set of guidelines to clearly define what constitutes borderline resectable disease was seen as an important step in addressing this inconsistency. 4 project aims were identified: agreeing and adopting a common statewide definition of resectability, designing a new radiological synoptic report, piloting the new tool, and documenting the resectability status in MDM outcome record and saving the synoptic report. A steering and working group representing key pancreatic surgery centers were established. After some discussion, the working group agreed the use of the international 2017 guidelines, which were unanimously accepted. To embed these guidelines into clinical practice, a standardized radiological synoptic report was developed using a co-design process.
So this project is exciting because it's actually got together a large group of doctors specialised in the management of pancreatic cancer and trying to work out a better way to triage these patients down various treatment pathways. We now found with better chemotherapy agents available, better and more aggressive surgical techniques, there's now a small subgroup of patients, another 15% or so, that now fall into a borderline category for surgical resection. And we need to find that group of patients. So we get together a group of specialists, we work out those definitions, decide that we're all talking the same language and using the same terminology, and devising then a synoptic report or a template report so that we can then triage those patients better and offer better treatment options and outcomes for patients.
This new tool allows detailed reporting by radiologists for surgeons at MDMs. The template consists of basic details, mass characteristics, arterial evaluation, venous evaluation, and the final section, conclusion and resectability status. This resectability status appears in the MDM summary notes. The report was developed for internally and externally acquired CT scans. Health services report on internally generated CT scans on their local radiology information systems, known as RIS, regularly. However, with more than half of CT scans tabled at MDM acquired from external providers, the project team needed to find an appropriate synoptic report entry platform to allow reporting of these patients. The project working group suggested using REDCap database, a tool already known to clinicians. It was also recommended we explore the Upper Gastrointestinal Cancer Registry, a secure existent quality registry built using REDCap and already collecting some of the pancreatic data. A decision was made and a new home was found. The UGI registry would allow completion of a synoptic report for CT scans sourced from outside the hospital for the purposes of a local HPB-MDM discussion.
The pilot at 2 health services targeted suspected pancreatic cancer patients listed for HPB-MDM discussion. The synoptic report was applied to the CT and the findings presented in MDM. The resectability status was documented on the MDM report and saved to the medical record along with the completed synoptic report. The results focus on 4 measurables, as seen in this slide. Additionally, we found that almost 60% of scans originated from external providers, which presented a number of challenges. And 17% of scans were of inadequate quality to enable assessment. Overall, we found that synoptic reporting facilitates the classification and documentation of resectability, was received favourably, and needs to be compatible for both internal and external CTs. Our data also demonstrated that poor quality imaging hinders the ability to assess pancreatic resectability. This is what some of our participating radiologists and surgeons had to say at the completion of the pilot. Planning for the next phase of the project is currently underway. For more information, please scan the QR code provided. Thank you for your time.